And welcome back. We are now talking about type 3 hypersensitivities, or the immune complex mediated hypersensitivities. Remember that in type 2 we were talking about a hypersensitivity that resulted essentially in no cell or tissue damage. We had blocking there causing problems, but here we're having damage with the type 3 hypersensitivity. And know that we have antigen antibody problems, and that the complexes are activating what? Remember what it's activating? It's activating complement, which would then attract what? That release lysosomal enzymes. Of course, it's neutrophils. Neutrophils are attracted that will then release the lysosomal enzyme, causing problems such as vasculitis. Remember also that immune complexes in this case may be composed of either self-antigens or foreign antigens. Remember then that with type 3 we have basically two mechanisms. First we have the mechanism of antibody deposition, and then we have the effector mechanisms of tissue injury. With the mechanism of antibody deposition, we have circulating immune complexes. But what happens is they aren't properly cleared, and then they are deposited in blood vessels, for example, and they would be planted there. And then what would happen is there would be complement that is recruited, and there would be Fc receptor mediated recruitment and activation of inflammatory cells. Remember what those inflammatory cells were? That's right, they were neutrophils, and you might see vasculitis. So let's talk a little bit more in detail about this type 3 activation system. Now, as we were saying, the enzymes that are released from the neutrophils are what cause the damage to the endothelial cells of the basement membrane. But antigen antibody complexes are normally produced during immune responses. The problem here is they're causing disease because they become deposited. And what would be a reason why they are deposited? Well, there are two possible reasons here. Mainly that they are produced in excessive amounts, and secondly that they are not efficiently cleared. So can you think of some places where there may be complex deposition? Where might you see this? Examples could be on blood vessel walls, in the synovial membrane of joints, on the glomerular basement membrane of kidneys, and on the choroid plexus of the brain. So let's have a little quiz here and try to guess the root resulting disease and site of immunocomplex deposition here. I'll ask you a couple of questions and you can see if you can guess the answer. First, if we have an intravenous or high dose and the resulting disease is vasculitis, what would be the site of immunocomplex deposition? Of course, this would be the blood vessel walls. How about for nephritis? This is renal glomeruli. How about arthritis? This would be the joint spaces. How about a subcutaneous route? The resulting disease here would be, for example, arthritis reaction. And the site of immunocomplex deposition would be the perivascular area. How about with an inhaled route? Then we could have, for example, a farmer's lung, and the site of immune complex deposition would be alveolar or capillary interface. The main point here is that the pathology of type 3 hypersensitivity reactions is determined by the sites of immune complex deposition. Considering this type 3 immune complex autoimmune reactions, let's discuss briefly two big problems that could occur. For example, systemic lupus erythematosus and also rheumatoid arthritis. So I'll ask the questions and you will answer. So try and take a guess at how many Americans lupus affects. Well, it's about 200,000 Americans, and it's 90% women. And generally, how would you recognize this? Well, the name is derived from the red skin rash on the face. What are some examples of what the autoantibodies are reacting against? DNA, blood cells, neurons, and other tissues. When cells die, where do the immune complex form and deposit? Examples would be under the skin, in the joints, in the kidneys, blood vessels, and also the central nervous system. So remember that the inflammation interferes with the normal functioning of these sites, which then results in things such as arthritis, rash, or kidney damage. So is there a cure? No. Most patients die from kidney damage, and symptoms treated with anti-inflammatory and immunosuppressive drugs. Now let's talk about rheumatoid arthritis. How many Americans does it affect? About 2 million Americans. Again, it's 70% women. What is the cause? Well, the cause is unknown, but it's suspected to be microbial mimicry, which means that the body is getting confused and it is going after the microbes, but instead damages the tissues. What are rheumatoid factors? These are IgM autoantibodies against IgG, which form complexes in the joint and lead to inflammation and cartilage damage. How might you notice this in a patient? It often causes finger and joint deformities. So remember here that there is no cure, and symptoms are treated with anti-inflammatories, for example aspirin and immunosuppressive drugs. Physical therapy keeps joints movable, and surgical replacement of joints may be necessary. So finally, finishing up this summary of type 3 hypersensitivities, let's discuss the immune complex disease and the clinical pathologic manifestations. Where are these immune complex diseases deposited, and what are the resulting problems? Let's start off with systemic lupus erythematosus. Where is this manifested? Nephritis, arthritis, and vasculitis. How about polyarthritis nodosa? This results in vasculitis. How about post-streptococcal glomerulonephritis? This results in nephritis. How about serum sickness, clinical and experimental? This would result in systemic vasculitis, nephritis, and arthritis. How about Arthus reaction, experimental? This would result in cutaneous vasculitis. Okay, thank you very much. I have enjoyed this type 3 introduction, summary of the hypersensitivities. Tune in next time for type 4, delayed type or cell-mediated hypersensitivity. Thank you very much.